Welcome, everybody. Excited to have you guys on here tonight. I know a number of us have met, and a lot of us we have not. And so I'm Dr. Dan McClimon, for those of you who I haven't met, and we have Dr. Curtis Martin as well.
Nice to meet everybody, and thanks for taking time to meet with us tonight. And hopefully we'll be able to share some great things about SoftWave and really help you kind of point you in the right direction as far as helping your offices and help a lot of people in your community. So I think tonight's going to be fantastic. I'm excited.
Yeah. Hey, everyone on here tonight, I just want to let you know that the chat is enabled for everyone. So any questions that you have, any topics that you want to have covered, this webinar is going to be customized to what you all want to learn about, questions that you have. So go ahead and put them in there throughout. Dr. Martin and I are going to go back and forth and share some things. But we're very excited to be connected with you guys. We have a heart and a passion for helping reach as many people as possible with SoftWave and ShockWave tissue regeneration care. I'll let Dr. Martin talk about his background and his practices. I'll just share briefly. So about my background, my wife and I were both chiropractors, and we have a brick and mortar practice here in the Southeast Pennsylvania area, about an hour from Philly. And it's just about 10 years old at this point, and we have an amazing team. We have 12 team members and 3 associate doctors. So my wife and I have not been in the day-to-day operations for about 4 years now. And I have 4 businesses, the practice being one of them. And a lot of the times when I speak to doctors and clinic owners, they're looking to have more freedom, more flexibility, the ability to operate within their green zone or their sweet spot. And, SoftWave, as we're going to get into, is an incredible way of helping the people that are already in your practice at a deeper level with things beyond the adjustment instead of referring to whomever and hoping for the best. And so, when you're able to build that SoftWave side of your practice, or what I call a business within the business, it generates an incredible amount of impact, but also a significant amount of revenue and profit to be able to grow your team and have it run without you. And so that's just a little bit about my background. And in our office, we're heavy chiropractic. We adjust about 600 people a week. We do a lot of SoftWave. We have 2 units. We do a lot of neuropathy, decompression, as well as full body medical lights. And so our practice is 5,100 square feet. And, when I coach people along with Dr. Martin, we both come from a place of this is what we do on a day-to-day basis. We've done this for years. We're in the trenches, so to speak, and the things that we're teaching on and helping to build certainty with folks on are things that we're training our own teams on a regular basis as well. And so I think that perspective is important. So a little bit about where I'm coming from in terms of the coaching that we do. And then Dr. Martin, if you'd share a little bit about your background too.
Sure, absolutely. And yeah, I'm excited to share with you. So very similar, we have very similar passions as far as helping people in the community. My story was I've started my practice from scratch 28 years ago, built 1 office into 2 offices, into 3 offices, and then basically same thing, associate-driven programs, scalable business, helping a lot of people in our communities. And it was all from just a core belief that, our communities are better when they're under, the type of holistic care that we can offer them. And I think SoftWave is just it truly is one more way to help people heal from the inside out, which is the whole philosophy of chiropractic. My story is that I got into SoftWave about 4.5, almost 5 years ago. And really it was built out of necessity. I was in a bad injury in 2016, took me down. I went to the hospital the first time I think ever in an ambulance. Scary, laying on your back, bouncing on the road, watching the top, going, geez, this is not where I want to go, being a chiropractor at that point in 2016. I guess I was a chiropractor for 18 years. So never wanted to go to that side, but nevertheless had to. Spent a week in the bed, just laying there, couldn't move my legs, came home in a walker and was facing surgery. and it was laminectomy with possible, due to instability, a cage. And so that didn't sit with me too well, being that I helped people avoid that for years and decades. And so when that hit, I was like, geez, there's got to be a way. And it sent me down a path of searching other answers. And that's when I got into stem cells, specifically learned about cellular health. And so since 2017 onwards, the good news, knock on wood, I was able to find a way to heal and stabilize my back. So I'm happy to say that I'm doing quite well when it comes to the back health. But SoftWave was a big instrument, and I actually got it selfishly just to help myself, trying to get, trying to claw and fight my way back, and to get my health, and I did that. And so SoftWave was one of those things that was just absolutely amazing. And I think what Dr. Dan and myself really love to do is to make things efficient, because when things are efficient, you can help more people, which is a calling to us. When we help more people in the community with the right care, don't hurt them. It's just everything we talked about, non-invasive, little risk. And this SoftWave harnesses all that. And so in the formula of healthcare, they always say start off with the least invasive with the highest likelihood of helping the patient. So I saw that and I was like, there wasn't any systems for scalability to really, like Dr. Dan said, a business within a business. And so we've kind of cracked the code and figured it out, and now we're ready to share. So after really divulging into coaching, it was only, my Dr. Dan and myself were only taking referrals for several years until now. This is probably some of you the first time we've ever heard our names, but we've been doing it a long, long time, both formally coaching, informally coaching, and now formally coaching SoftWave. So that's a little bit about myself and some of my passion. But yeah, when you get the machine, I look at this, and I was talking to Dr. Dan. I said, it really is not a modality. It's I would disagree with modality. It's really a technique of cellular healing. And the more you know about cellular healing, the more you can help those difficult patients. And I think what speaks to my heart, and Dr. Dan's as well, is if you don't help them and you don't find a solution for their problems, where are they going to go? And so you got to know all the different ways and learning systems. And we're going to get into that. We're going to give you some gold nuggets today about cellular healing. When you get stuck, or you're just feeling, I don't know where to turn. Am I using too many impulses, not enough, high frequencies, low frequencies, whatever seems to be, locking you up. We're going to explain some of those systems to you and how to get around that for the best outcome, not so much for you, for the patient. And then when you're taking care of the patient to the highest ability, everything just kind of flows from there downwards, and everything kind of works its way up from successful business to scalability, to building your right reputation, to become an expert in cellular healing. And that's really what you should be.
Yeah. Yeah. Guys, I just want to remind everyone on here that we would love to hear what specifically you want to know about this. I mean, Dr. Martin and I, we do this every day. And so, we're going to hit on a lot of the topics that we get questions on a regular basis, from people who don't yet have a shockwave unit to people who do have it, but they haven't really formally launched it. They maybe just trickled it out a little bit, to people who have had it for a year, year and a half, 2 years or more, and just don't feel like they're getting the most out of it. They haven't systematized it, incorporated it um, into their practice. And so we'll speak to some of those things, but by all means, please just go ahead and put in whatever questions that you have, and we'll make sure to hit on those on this webinar. Like Dr. Martin said, we've only taken referrals for the last number of years. And so this is really the first time we're publicly, serving the profession at large, with what we get to do every day, which we love doing with this coaching. And I'll tell you, it's not just within the chiropractic profession. I mean, I have a group of neurologists in Arizona. I have a couple PTs, a lot of chiropractors, a naturopath, an OBGYN, a podiatrist in Las Vegas. And so, Shockwave and SoftWave is growing, but really, and I was just on a call yesterday morning with the doc, and he was telling me, that I've had this for about 6, 7 months, trickled it out a little bit, but I really want to know how to effectively launch this to our current and past practice members or patients. And then I want to know how to have systems. So just like chiropractic, if you're on this call, you've hopefully dialed in systems and refined your systems and the roles within your team to help to drive the level of service and impact through your practice with chiropractic. And so I tell people we build the SoftWave program in the same fashion as a corrective care chiropractic office. And so those systems, the way in which we communicate it, the way we build value, all of those things are vital to growing the program, helping more people. And then after the internal launch, a big pitfall is just relying on external marketing, on Facebook ads to try to get people in. That's only going to go so far. So between referrals, retention, moving folks from corrective sessions to maintenance and optimization sessions when appropriate, to doing internal workshops and promotions, referral networks within your community, in addition to external marketing avenues, as well as webinars. Like for our brick and mortar practice, I'm not in the day-to-day, but I do typically a couple webinars a month and maybe an in-person workshop or two per month to help to drive people in. If I can invest a couple hours of my time, and then we have pre-educated and prepaid people coming into our schedule for appointments, that's really where we found our sweet spot. And I'll just say this, and we've been very, very blessed with great mentors, both Dr. Martin and myself, for many years. And so we're so grateful for that. And we want to help more of you within the profession in the same fashion. But with our first SoftWave unit, it has been busy, full schedule for just right about 3 years now, between three groups of people. One is the folks who come in for chiropractic care who want SoftWave care and getting them over for that. Number two is referrals. And then number three, we do a lot of neuropathy. So our neuropathy folks also get SoftWave. So there's zero external marketing for our first SoftWave unit. For our second unit, that's where we do more of the external marketing and workshops and things that way. But these are the kind of things that we want to be able to share with you all, to be able to give you clarity and to also be able to give you certainty. In the coaching that I do, and I know Dr. Martin would say the same, one of the biggest concepts is not in what we say or what we're describing, but in how we're doing that, how we're describing it, the way in which we communicate it with value, and the certainty with which we do that, that's going to earn people's trust. And I will tell you this, it is not that complicated. Yes, there's depth of advanced protocols and techniques, and Dr. Martin will speak to that because honestly, I've been to the international conferences, the national conferences, I've spoken at some of them, and Dr. Martin is the most advanced doctor and trainer and coach in this space. He's helped write textbooks, the advanced protocols. So that is a unique thing that he brings to the table among many other things. He could help you with all aspects of your practice. Really a blessing to have him to be able to work with. So I want you to know that about him. But really the core foundational elements that need to be communicated with SoftWave are actually quite simple. And you get a lot of agreement when you can communicate those things simply. People are looking for what we have to offer. And the last thing before I pass it back to Dr. Martin that I'll say about that is, I tell this to people all the time, the folks who are coming in to our chiropractic offices are the ideal candidates that need and want and are looking for what we have to offer with SoftWave. So that's my 2 cents here as we're getting started. Keep putting those questions in, and Dr. Martin, I want to give it back to you.
Sure. Yeah. And I couldn't agree with you more. It's what we do is confidence and certainty and conviction. And it takes training to get to that point. And I think the reason why we're kind of sharing with this today, and hopefully you guys get it, it's not as complicated as you think, but it definitely takes work to get it so it flows easy, right? So, and that's what we're going to help you do. So the first part is that'll be your gold nugget today is like, well, how, Dr. Martin, do I all of a sudden get excited and get the whole practice? And really the casual conversation that we're currently having is very comfortable and it flows. If you get into that same flow state with your patients and get really excited about what this new technology that's coming in from Germany that was never exposed, and that almost like you have your best friend. Okay, so here's what you want to write down like your best friend, and all of a sudden you find out something that's like never been heard before, and you're excited to share with your best friend about this special new technology. And then you tell them in simple form, I got this special new technology from Germany. It's like a sound wave that basically allows acceleration to your body, right? It actually, the number one things, it causes advanced cellular healing. So no matter what you need, whether it's more bone cells, more ligament cells, more tendon cells, it will deliver the necessary cells to allow that advanced healing to do it. Would you like to come try it? Yes. And so I couldn't agree with it. It's not so much the words, because we can get into some of the scripts that some of you need that to kind of proceed, but just the love and energy and just really excited, that one-on-one and getting your whole staff behind you, which we'll talk about. Like when you get the first shockwave in, people say, oh, I got to get my first 10 or 12 patients. And I would say with all my best staff members, and Dr. Dan, you would say this too, your best staff members that have been like your rocks that just promote your practice, it's because they've usually had a miracle story with chiropractic, with the experience. And so when you first get it, I would encourage, in fact, I would tell you to make sure that any of your staff members that has an ailment, let's have a treatment so they can have an experience. What about their family members? What about their children? Maybe their parents? Because when they get behind about how you've helped them, that's when they can get excited to share that with the entire patient base. And I would 1,000% agree with Dr. Dan when he says this is made for a chiropractic office, right? If you talk about the perfect avatar for advanced cellular healing, it is this machine. So think about this. Hopefully this resonates with some of your philosophies. Chiropractic releases the innate intelligence to flow through your entire body. And the damage of subluxation sometimes can only repair to the best of its ability. Now you have something that you can apply, SoftWave, to that damage from subluxation to correct even to another level of restoration. A perfect cellular innate and body innate together has exponential. And that's where we see truly miracles, Dr. Dan. And we'll hopefully speak to some of those miracles. People that have had pain, people that haven't moved a body part in 10 years, all of a sudden that gets restored, haven't lifted their shoulder past here in 10 years, first session. It's absolutely, and the right word is not life-changing, it's transformational. You're going to see tears come down people's eyes when they get to experience how to deliver this technique to people. And then also the ones that are really tough, because we're talking, like Dr. Dan said, this is pretty easy to use, right, Doc? But what about those tough cases? What about those cases that really, they're swollen, they got 4 or 5 different medications, they're not healthy, and even any application of a therapy could potentially cause them to be sore, and all of a sudden they say, don't want it. What do you do? How do you support it? Well, we've learned all those, by our own mistakes, and that's what we bring. I think we've learned mistakes when someone calls us in the middle of the night and said, your machine hurt me. I remember 5 years ago, I didn't have an explanation. And now we avoid so many things that could have ended up with a disaster of them just getting hurt. I remember first time I heard a patient, Doc, swole up her knee, used it one time, didn't know what I was doing, just rolled around in the knee. Her knee swelled up so big. I made house calls every single day that week, chiropractic adjusting, doing light effleurage to get that swelling out, not having a clue of why the knee blew up like a softball. And all of a sudden, then we started learning systems, didn't we?
Yep.
Endocannabinoid, cardiovascular, lymph systems, how to support all those systems, how to deliver the right amount of shockwaves so that response doesn't happen. And all of a sudden now it's 99.9% people go, this really works. And that's, to me, that's where you build a good reputation. I think all of you on this, I hope all of you are saying, I'd like to build my reputation as being a cellular healer in my community, help a lot of people.
Yeah. And I think that really comes into, just like chiropractic, the science, philosophy, and art of chiropractic there is an art to this technique. And we were speaking earlier in one of our meetings today, and you had just mentioned the example of, this isn't just some magical device that you move around at the spots that hurt and hit those spots and hope for the best. You know, I've had a number of coaching calls just today and this week where, we're talking about up the chain, down the chain, different techniques. Maybe they feel it in their elbow, but, are we working areas in the neck and the shoulder and so forth? And, I would just want to share a couple things. So Dr. Randy has a great question here. And he's asking if we can share about our range of neurological and neuropathic conditions that we've worked with and results. So I want to touch on that. And then one other thing that I want to share with you all, because I get this question a lot, is about the internal launch, and the friends and family internal launch is what I call it. And Dr. Martin and I have really gotten that dialed in along with the help of our teams. So that is something that I want to share, that framework with you guys today. So if that's something that you have a question on, we'll be sharing that shortly. And just so you know, if you didn't see it in some of the ads and the communication before this webinar, our SoftWave launch, and I say this, if anybody knows anything about me, I'm not one to talk about myself. Humility is a huge thing for me, and humble leadership and servant leadership is what I focus on. My wife and I, we have 4 boys, and that's something that we worked to instill in them. So sometimes I don't talk as much about the results that we get and the numbers and things, but I want you guys to know this because I know what's at stake. If you flounder, if you don't have certainty, if you don't have clarity on your systems, and there's just too much at stake, too many people who need the help are praying and hoping for help. And if we're not really sharp with what we do, they're not going to get it. So I am going to share that with you. And so when we launched our unit 3 years ago in the spring of 22, excuse me, we had the largest internal launch in the world of a SoftWave unit in our chiropractic practice in Southeast Pennsylvania. And I'm going to share more about that later, but we started 108 people with care in 3.5 weeks, and it generated a significant amount of revenue, over 300,000 in revenue in 3.5 weeks. And I say all that to say that there's a right way to do that. And like we talked briefly about the results and, some of the life-changing and transformational results that we've seen, those 3.5 weeks were littered with them. And in addition to our practice members, I'm talking my mom, my dad, aunts, uncles. One of my uncles, they wanted him to see a neurosurgeon to be scheduled for neck surgery and fusion. And between adjustments and SoftWave, he avoided that. And it took like 4 days for that situation to be resolved. And so, my brother, there's just family. And I call it the mother standard. We take care of our folks the same way we take care of our own family, my own mom, etc. So we'll share that with you. But just to speak to Dr. Randy's question. So I do an awful lot of neuropathy. I've been formally coaching folks with neuropathy programs for just over 2 years now. And we've been doing it for years in our practice. So if you want to talk neuropathy, I mean, diabetic neuropathy is about 1/3 of neuropathy, but, there's from statin drugs, metabolic conditions, Agent Orange exposure, bacterial and viral infections, obviously spinal degeneration, chemo-induced neuropathy, alcohol, smoking, along with the bacterial and viral infections, vaccinations, COVID shots, a whole nother thing. So we've seen all of that, post-surgical neuropathy, trauma. And so, there's a protocol there that we do with home care, but as far as in-office care, we get them adjusted. And for the last 3 years, since we've added SoftWave to our neuropathy protocol, the results have gone way up. Much greater improvement in the same amount of time or less. And just one tidbit I want to share with you on a learning that we had was, if your typical neuropathy case is going to work, from distal to proximal. So toes, back the foot, up the ankle, up the leg, all the way up to the knee, sometimes beyond. Same thing with the fingertips. So with the neuropathy in the feet, at first we were just working the SoftWave on the feet and some of the ankle. But when we started working in the more proximal, healthier tissue, where the trunks of blood vessels and main branches of the nerves come down the leg, so in the calf, behind the knee and down the calf, and the lateral leg down, people who weren't getting the breakthroughs started getting the breakthroughs. So that's just one thing that I wanted to share with you in terms of the neurological or neuropathic. Neurological, Dr. Martin can speak more to this, but an awful lot of folks have issues. I mean, just about everybody, guys, if you sit them down and you do a mapping of their lumbar and SI joints and that iliac crest area, you're going to change their life. I mean, it's incredible. And just one more before I pass it back is just on Tuesday, we had a guy who he'd done very well with care. His neuropathy got significantly improved, but then he had a knee surgery that he couldn't avoid, and he fell off the care. And we had a couple conversations, and he got back in the office last week, and I saw him on Tuesday. And one of the adjustments we made based on what he was experiencing was we moved the SoftWave from working the neuropathy area to low back and SI joints. And you should have seen his eyes light up telling me after 1 or 2 sessions how much better he's doing already and how excited he is to now be doing SoftWave in that new region. So a lot of the neurological stuff, SoftWave, and Dr. Martin will speak to that, but the way that it clears senescent cells, the way that it modulates inflammation, the cellular healing and regeneration, it's life-changing. And it's not going to be everything for every person. There's limitations of time and limitations of matter. But in my experience, about 80 to 85% of people, it is the ticket, in addition to the adjustment. So maybe Dr. Martin, if you wanted to continue along that line.
Yeah, I think so. And I think the one thing that sometimes doctors and people that are listening to this, healthcare professionals, and hopefully they're not just chiropractors, but sometimes you only have one shot. You know what I'm saying? Like a lot of times as chiropractors, they unfortunately put you a little bit on a soapbox where you're like, you got one shot to prove to me you know what you're doing. And when we do this, I had one of my docs call me either this morning, no, it was last night, and he said he had a patient come off the decompression table and disc coming down the leg, sciatica, pain every single day over the last year. And he goes, let me do shockwave. And did shockwave on this patient with the right protocol, and got off the table and looked at him and goes, what? My pain is gone. No, you don't understand. This is the first time I've been pain-free for 1 year. And that's what we're talking about. Like when you do the right protocol, when you change someone's life, when they've been hurting every single day, and I've been there, right? You're clawing to the bathroom. It hurts when you sit down the toilet. You can't sit at the dinner table because your back hurts too much to eat. You're laying on the couch all the time because you really can't walk around because it's hurting. And all of a sudden, that changes for you. That is absolutely how you get your name on the map. They got full attention to you. And I think the one thing that I think we have to start talking about is intention in what we do. And when you have good intention, like Dr. Dan, we have a lot of intention. We just know the power that made the body heals the body, and that body's either going to heal or adapt. But what you just gave that patient, which is worth this whole call today, is you just gave that person in their heart full of this magical thing called hope. When they've been told by all the healthcare providers that neuropathy is not treatable, lower back pain, you need surgery. Your bone on bone, the knees, you need surgery. It's so defeating to those patients. And when someone tells you that, you just got to rip that banner and say, that's not the case. You were made perfect. And we just are releasing that interference. And that's what chiropractic does. That's what SoftWave, removing the interference so the body can do what it's intended to do. And that person flows out with all kinds of hope, which we just gave you another gold nugget. How do we get so many referrals? You send those people out to your community that just got that kind of experience. Watch your phones blow up. Because when I was in the office, before I stepped out of the office and just ran the office and did coaching, I would get, just like Dr. Dan, a referral every single day. I expected it because of the good work I did and helping that family, that person, that lady, all of a sudden deliver her baby better, whatever the case may be, that phone would be ringing. You have that same opportunity in SoftWave. And let me tell you one more secret. The machine always works, but how you use it takes specialized training. And that's the truth of it.
Yeah. Doc, would you speak to, we get a lot of questions about, how many pulses, what
Yeah.
energy, how often, how many visits per region, and, all of those kind of things. And so, you're really clear with the way that we operate is based on diagnosis. And one of the qualities of Shockwave is that it has a biofeedback component to it. And so, we don't just use the term a mapping session for no reason. But if I think people would really benefit from hearing you share a little bit about how we make those recommendations based on diagnosis using that biofeedback component.
Yeah, that's a great. So a couple things is this happens all the time. There's other, I have a software sitting beside me. There's basically only three settings, right? There's the energy setting, the hertz, and the amount of shock waves. It's very simple, right? Those are the three things that can be manipulated from a component standpoint. How you use it is something different. So what we do, the best way to look at this, and this is what you should be looking at, is it's based on the diagnosis of what we found. Is it a sprain or strain? Is it a disc? Is it a rolled ankle that has multiple ligaments? And then once you understand what the diagnosis is, then try to do the examination to pinpoint where the damaged tissue is. And that'll determine the size of the injury, whether you got a golf ball injury, maybe a ligament, maybe a whole, maybe it's a whole quadricep muscle. And that size combined with the depth of how deep you treat, right? That's the energy. The energy is what the depth it is. You want to get in the sweet spot. There's a certain, and we can teach you more about that, about how many millijoules that we're trying to get to. And think of it as an onion. Sometimes they can't take the amount of energy to get deep enough. But again, with repetition, you can get to that depth. So really the amount of shock is based on that criteria. The size of the diagnosed injury, and also the depth. How deep is this? Those are two criteria. And what Dr. Dan is speaking to about the biofeedback, which is incredible, it doesn't render the diagnosis. Okay. So when you do that, oh, that's the spot. That's not diagnosing. Your examining, your consultation examination, possible films and MRI, that's what's diagnosing, but you're confirming that diagnosis. So get into the aspect or thoughts to say, I'm confirming the diagnosis with, you find a spot and they go, ooh, that feels, and when it's a 6 or 7 out of 10 where they really feel the spot, and then it's time to use the technique that's going to allow that area to clear that inflammation, allow cells to be cell signal to come to that area to treat that ligament, to treat that muscle. And so that's the biofeedback loop, if you will, that is so good, but it's confirming a diagnosis rather than rendering the diagnosis. And the shock waves is really determined by the size and depth that you're treating. That's how you really do it. If you have that principle and philosophy, it'll make it a lot easier when all of a sudden you go, hey, Dr. Dan, how many shock waves? Hey, Dr. Martin, how many shock waves? And they're like, oh, well, Doc, what you just shared with me makes a heck of a lot of sense. I don't need to call you. I know the size. I know the depth. Let's make sure we cover the area. Let's diagnose what ligament. Let's treat the diagnosis. And then there's other aspects in order to amplify or intensify the healing. And that is some of our specialized talk, Dr. Dan and myself do this specialized technique to really get the maximum using all the systems of the body to intensify that healing.
Yeah. And how many of you all have had questions from people about, well, I talked to this shockwave doctor here and they do it this way. This is how much they charge. Why are you different? Or I was on vacation in South Carolina and I saw somebody there for a few sessions and, they do it different. Can you do it like them? And, if you do this enough or long enough, you're going to get questions like that. And, knowing these things inside and out in terms of the reasoning, the rationale for why we do what we do allows both you and your team to, with certainty and consistency, answer those questions based on rationale, based on purpose, based on, our criteria for why we do what we do, why we charge what we charge, and the results that come with that. I tell people all the time, I say, look, you can give a paintbrush to anybody off the street, or you can give that paintbrush to Picasso. and the value you're going to get by how that tool is used is night and day. And so, I think that that's really important. That's a question that I get a lot. And so, yeah, Andrew, certainly we can get the recording to you guys. I'm happy to do that. Listen, guys, I would love, and there's a couple more questions in here coming through. Keep putting the questions in there, but I would love to know, for those of you who are on here live right now, how many of you have formally, in an organized fashion, launched your device to your current patient base or practice member base, so current and past patients that you've seen? How many of you have, in an organized fashion, launched that and made dozens, if not 100 plus appointments to your current and past people? Because for me, that's the quote unquote lowest hanging fruit. You invest in an $80,000 machine or whatever you go with, that thing's paid off in 4 or 5 days, if you do this thing right. And the launch that we have, or that we had, we've helped over a dozen offices reproduce a similar launch. Our average internal launch does about 150K in about the first 4 to 5 weeks. We've had a couple do like 190, 200. And I talk about the revenue because you need revenue and profit to run this. I mean, if you don't, you're not going to be doing it very long. And you don't want to be tied to needing to do that yourself as the doctor or clinic owner. You want to be able to have the right people in there doing that technical work and then be able to train and support them. And that's a lot of what Dr. Martin and myself do is, train and certify and support teams to grow these programs, not just the practice owner, but the team members. Oh, Andrew, that's awesome. So first launch is tomorrow. 20 people scheduled. Exceptional. Man, that's great. We'll be praying for you. We're here in your corner. That's going to be amazing. Get ready for a lot of lives change there. So there's a couple questions here. Dr. Martin, one is around insurance codes and whatnot. And I mean, I'll just say my piece on that is, at least in Pennsylvania, some PI insurance will reimburse on it. So really the only thing that we'll bill for our SoftWave is if it's an auto case. Nothing else really covers with that where we are. But our practice is 96% cash anyhow, and about 4 or 5% insurance. So we don't do a whole lot of that. I think in the Western states, there might be a little bit more with some of the veterans insurances and things. But my opinion is be able to communicate the value so well that people are willing to pay cash. And then if they get, a little bit of insurance reimbursement or whatnot, that's just a cherry on top. And then, Doc, the other question there from Dr. Randy is, it sounds like SoftWave is an adjunct to other healthy interventions, nutrition, detox, exercise, other manual interventions. Has it been clear that the more comprehensive participation is the better the outcome?
Yeah.
So
And I think what you're saying, Randy, and hopefully clear that is like sometimes certain cases need a multidisciplinary approach, which means they might need some cases are simple, maybe they just need chiropractic and SoftWave. And some the individuals they're metabolically sick and they definitely need to detox prior to doing that. Or maybe we need to encourage their lymphatic system to get moving with maybe like a vibration plate or something like that, just to kind of get some cells moving prior to engaging with proper care. So that's part of what we teach is how do we what do we diagnose these people? And that's part of the diagnosis we spoke to is like when you start getting really good, you can understand about the level of health that this individual is. And really, then you can start getting to a point where you can understand what they're able to handle and not, because we all know this. I remember, Doctor, I don't know if I told you this, one of my first clients one of my first ones, he goes, "Oh, Dr. Martin, I heard you're really good." He was from Southern California. And he goes, "Doc, how many people, since you've had this machine for a couple of years, how many people have you had that has fainted?" And I'm like, "What?" And I'm like, "Yeah, I've had 3 people this year faint." And I'm like, because he cranked up the energy so high that people just And I'm like, no, you got to lower it down. And he goes, oh, that's a good idea. But sometimes you got to, meet with where people are at, meet them where they're at, work with them. And that's why it's really, when you think about the nervous system is so important to harness and all the systems, and then incorporating with certain conditions, several different healthy interventions like laser, like decompression, like HBOT, like low level energy lasers, such as like what do you call it, class 2, class 3 laser. All those things is when to use them, when not to use them, when people need more ATP activation with the cells because their energy in the cells are so low and they just can't get the energy enough to heal. That's what we're talking about. It can get really deep really quickly, but the other part is you'll start recognizing patterns, and that's your job. Like if you're going to become the best at cellular healing, and it's not hard, it just takes some effort as far as putting in the time. And I got to say, Andrew, we're praying for you. Let's have a great launch and get to the reason why these people are coming in. Why are you here? It's not just neck pain, back pain, but what do you want to return to? Ask them what they want to return to tomorrow. And then after that, just tell them after that first mapping session, one's not enough to become more permanent. And if you need, please reach out. I'm happy to get Dr. Dan or myself to give you some help as far as to get things going. But great way to introduce to the practice, and hopefully tomorrow's 20 people and next week's 20, 20, 20, 20, and hopefully you're shooting for over 100 people. I think every single person in the chiropractic practice, whether they're active or inactive, deserve the opportunity to go try this machine to see if they can upgrade and elevate their healthcare.
Absolutely. One of the things that Dr. Martin is excellent at as well is, helping to identify, what kind of support people need when they're not responding like we would expect them to. And, one of the things that I learned from him is, if people are really toxic and inflamed and their gut is a mess, sometimes they need to take a month or two and get that cleared up before we really dive into the shockwave. Or while we're diving into shockwave, they're supporting with specific nutrients. And so, these are some of the questions that we get from people. Any other questions that you guys have, go ahead and pop them in the chat there. And we'd be happy to address them for you. Doc, is there anything else you wanted to share? Do you want me to go into the overview of what we do with our launch process?
Yeah, I think let's jump into the overview. I think just to touch on that, and thanks, Randy, for just putting in now. But these people really need care, and there's a lot of people that are going to be unhealthy, and there is different, very clear consultation exam questions that will dictate how healthy they are. And some people just need, you'll run the device over that people have had achy shoulder, achy back for years and years and years, and yet you sometimes don't get the biofeedback. And you're like, well, I know there's a problem there, but I just can't figure out. There's a reason for that. And so in these things, rather than just letting these people go out the door, and I remember I had a patient like that, no response on the first treatment. And this was probably about 3 or 4 years ago now. And I said, you know what? I know it's damaged. Let me just do the shockwaves in there. And lo and behold, it was like visit 3, 4, and they came in with tears in their eyes. And they go, Dr. Martin, I don't know what you did, but all of a sudden on visit number 3 and 4, they started to get the first relief in years. So again, that's why you really need someone to guide you and train you, because there is going to be patients that get no response with this biofeedback loop. And then all of a sudden you're like, well, maybe they're not a good candidate for shockwave. But the examination, the consultation says yes, 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 yes. And all of a sudden they're missing certain nutritional or certain hydration things that are missing to make this work. Well, that should be identified. And again, I think Dr. Dan, both me and you, is every life is a life worth saving. And I don't want to help one person come in the door or just have like doctors talk about, oh, I help 50% of people come in the door. What's your start rate? 50%. And really, I was talking to Dr. Kramer, a good friend of mine. I go, what's your start rate? And he goes, oh, probably 120 to 150%. And I go, 120? He goes, yeah. He goes, because every single person that comes in, they usually have a loved one at home, and that person gets care and changes their life. Let's not get one person healthy in the family. Let's get the whole family healthy. So one patient should turn into two, should turn into three. And that's really, it just has to go real deep in your heart to go, you know what? I'm here to help every single person in my community rather than having, I'm a 50% closer. I would not get behind that flag. I would say, you know what, let's try to help the whole community. And that's why we have things formal, but are hopefully you can really feel what we're really all about. And then now we got the system. So Dr. Dan, if you want to give them the format of how when we get a machine, whether you're getting a machine, whether you got a machine, whether it's a launch, relaunch, let's go ahead and share the framework of how this is going to go for you.
Yeah. I think what you said there, it can't be missed. That can't just be glazed over, because really the X factor, or the thing that separates even very good practices from elite practices, the great ones, the ones who are doing, incredible things and numbers and volume and all of that, it all comes back to the heart. And do you actually love the people, actually have their best interest in mind? I tell people all the time, I'm not interested in your business. I'm interested in your commitment to the process, because I know what's at stake. And, every talk that I do, every coaching call that I have, I mean, whether it's talking, B2C, so to speak, to our consumers or our practice members, or B2B, talking with other, doctors and practice owners, that's really where it has to come from. I think about John Maxwell. I'm going to be spending some time with him next week. And, I've been listening to a lot of his teachings. And, one thing I just can't get out of my mind that he said, when I tell people in an audience that I love them, you sometimes, like, for example, this lady had a question. She said, I don't mean this any other way than I'm just curious, how can you know that you love me if you don't even know me? And what he said was, he asked permission first. He said, to answer that question completely, I need to bring my faith into it. And so, is it okay if I answer the question based on my faith? And she said, absolutely. I'd love to know. And he said, I love you because you're a child of God, because your life has value. And if God loves you, then I love you. And so whatever your background is, or whatever your faith is, we really need to get past, the basics of survival, of covering the overhead. We have to get away from the scarcity mindset, and being so strung out on how many pulses and how many cents and all this. You got to be so freaking successful and good and effective at communicating value that those thoughts aren't even entering your mind. You're just serving from your heart. Yes, you need to be good at the business and organized and all of that, but when you can get past that, that's really what separates the great ones. So, a lot of this work is mindset, it's communication, it's value, it's certainty.
Yeah.
Uh, so I
Nicely
wanted,
put, Dr. Dan, nicely put. And I would say that this, and I agree with you on multiple layers, not to repeat what you said, but I believe that every single person on this planet has greatness in them. And it's really our job to really help you bring that greatness out. I believe that. That's why I love being a coach. When someone says, what do you love doing? It satisfies me to see and cheer someone on. Like when you had your best launch, it's like I'm just cheering you on because it's bringing out the greatness in you to become great for your patients and bringing out that patient's greatness. And it's circulating love and vibration through that office, which is contagious. And we talked about, how do we get more patients in? You start thinking about that and talking about that and speaking to that with your staff. Just watch the phones. You'll get people just just busting down your door, and that way you're not like totally reliant on external marketing. So I couldn't agree with you more. Well put.
absolutely. So I want to, there's one question as we're going to bring this to a close. Any other questions, please go ahead and put them in there so we get them answered for you. One here is about, as far as becoming better at actually administering the care, are there training videos for diagnosing, being more effective? Absolutely. Dr. Martin has, I don't know how many hundreds of hours of trainings, and he's worked with software developers to actually build a bot where you or your team, that's one of the huge pieces of value. You or your team can put in a question, and that bot scours all the information, hundreds of hours, years of content, and will deliver the answer just for quick access to those kinds of things. But I mean, he literally wrote the book. So there's a full book written on protocols, advanced protocols, amplification techniques. So yes, all of that is covered. And then there's one here, Andrew, I want to come back to about, just want to hit that before we wrap up. But so I just want to share the framework of this launch that we've done in Pennsylvania. So we've done it for SoftWave. We also did it for full body medical lights and weight loss. I helped a practice in Jersey do that as well with the lights. But Georgia, Florida, Illinois, Wisconsin, all over the place. Trying to think where Massachusetts, Georgia. So this process is tried and true, and basically what we do for SoftWave, but also neuropathy, any internal new vertical launch of service, the framework of what we do is we leverage video and we leverage text and email to your current and past practice members of the list, and leading up to when we want to start seeing those people, we do a series of videos to build urgency, excitement, and also scarcity. And the framework is such that, and it's funny because I think back, and I'm so grateful and I smile that, when I was going through this process, for some reason or another, I just documented everything. I took pictures, I did videos, audio recordings, kept detailed notes and stats. And, I figured if nothing else for my buddies, if they ever want to, do this. And now that I'm formally coaching, it's invaluable to have that. But these videos are like you're sitting knee to knee with a practice member you've been taking care of for years, and you're explaining it like you're explaining it to a friend or your family, and who is it for, and what kind of conditions and the results and why we're excited about it. And then before we make this available to the public, we're blocking off this amount of time, and you get them scheduled, and but that's only part of it. And so whether it's a launch or it's an organized relaunch, if it never really launched initially, or it's been some time and you want to relaunch it, this is what's appropriate. But that's only the one piece of it. The second piece of it is, once they're in, how do you do an effective day one and day two consult, exam, mapping session, imaging, and report of findings, recommendations, getting them started. And then number three would be once they're through their corrective sessions, because mind you, when we launched this, we had 110 people prepaid and pre-scheduled, $49 and pre-scheduled for day one and day two, intake form filled out, and any x-rays that we wanted or needed taken ahead of time. And in 3.5 weeks, we started 108 out of 110 of those people. And all cash, no insurance, none of that, and 313K of revenue in 3.5 weeks. So I just say that to say process, certainty, organization, value, and procedures, But the third part of that then would be, once they're through their corrective sessions, what's it look like for a re-exam and conversion to maintenance and optimization? What do you charge? How often do you see them? What if they have a second region? What do you do with the first? All of that kind of stuff, really important. And so that's one of the things that I'm passionate about. So that's really what I head up a bit more of. And then Dr. Martin also does that and supports with that, but he has the full robust program in terms of technique and protocols and certifications and communication and amplification points, and just the depth of the whole process. And so if you're watching the chat, Renee's going to put in there a couple links to book calls, and there's going to be Dr. Martin's link and there's going to be my link. And so really, you're not going to go wrong with either one. We do this together. But what I would say is that if you're more in the time frame and position of needing to launch or relaunch, go ahead and book on my calendar link. And then if you've already launched, and you're looking for more of the depth and how do we continue to grow it and keep it robust and get our team trained up with technique and communication and more certainty, then go ahead and book with Dr. Martin's link. And so if you click on that link, Renee just put in the chat there, that will take you to our schedule. So I just wanted to make you aware of that. We're going to go back here. And then when Andrew's question, so Dr. Martin, patient tomorrow getting a session, dealt with itchiness from her neck to her arms. What recommendations would you have for her treatments? I don't know if that's enough information, but if you wanted to speak to that.
Yeah, I don't know as far as whether that's, it sounds like a new patient coming in with that type of symptomatology. And of course, when you're dealing with itchiness, oh gosh, anywhere from dermatitis to allergies to bowel, there's a multitude of different issues. So that's why you really want to sit down and take a thorough history and see if they're actually a candidate for SoftWave, right? So that's part of your doctoring to just see, hey, is this something that we can go ahead and help? Remember, it's advanced cellular healing is really what this does. So again, that's why you really need to take a good consult, good history, get to what they're dealing with, and maybe it is something like when you look at something like that, it could be some sort of dermatitis or it could be something else. But yeah, there's not enough information for me to kind of tell you, hey, go ahead and do this protocol. Here we go. She had a discectomy. Okay. Works well on, just so you know, using SoftWave, you can definitely use it on the discectomy. You can definitely use it on post-surgical hardware. So don't be concerned about that. A few months and improving and recently had a flare-up. See a neurologist. Yeah. So if it sounds like it's maybe like an inflamed dermatome, then go back. One thing too is, I don't know if it's neck and arm, but one thing to just protect, because of the sound wave travels over 3,350 miles per hour, always use earplugs. So if you're listening, you're getting a device, get those soft little earplugs, plug those up, palpate to see where the subluxation and where this maybe is coming from. If you do a tonal technique, Dr. Dan and myself use that tonal technique, use that. If you don't, then use a scope. And if you don't use that, then really good palpation skills. See if you can find that. And you can definitely use the SoftWave on that area. Try to be very specific with it. Usually in the neck, just so you know, energy level of about 8 can usually get into the facets. And remember that sometimes you have to wrap around the front of the neck because that's where the IVFs come out. So stimulating the IVFs in the anterior joint and the posterior joint is kind of right through there. So sometimes with neck, you have to get them in a sitting position or roll to the very front of the neck. That seems to be more effective. Yeah.
Yeah.
And just to speak to one more thing, just so you know, yes, in our platform, I think we have about 230 hours of recorded lesson plans. So we're very, very robust. It's a learning management platform based on just from the time you get a machine, everything you should know about how to diagnose, how to use it, the techniques involved, scripts you want to say to your staff, how to give a good report of findings. So then you have a 90 to 100% of people start. So that's why that learning management platform, we have a Slack to keep in communication with us all the time. And then also to answer your questions, we have that way, like Dr. Dan had said, that anytime you have a questions, typically the response time is less than 60 seconds. That's really based on as much science that I've been able to pull from Germany. And like I said, I've been a formal coach for doing this for solely, SoftWave for the last 3 years. So we have a lot of content, and we've certainly helped a lot of offices launch. And that's kind of the same thing. I think we've helped over 70 offices launch all by referral. And the other part is like say, Dr. Dan is definitely a rock star when it comes to of those launches. He's had the biggest start, so he knows what he's doing. So that's why we're teaming up. You really got doctors that are doing the best job we can to help the communities, and we're passionate about it, and we just love to teach and share.
Yeah. Yeah. And guys, so, I just wanted to say this too. Maybe some of you are on here and you don't yet have a machine. You're trying to figure out which one to use, and if you want to bring this into your practice. So, when I have discovery calls with people, a lot of them is about neuropathy. Some of them is about shockwave and, different things. Really, I'm looking for, is it going to be the right fit for them in this season in terms of time margins, financial margins? What does their team look like? Because the last thing you want to do is set yourself up for a disaster in terms of bringing something new in that you and your team are not ready for, and then the thing that you did have going starts to decline because of this. So, I think some discernment and perspective is important there. So if that's you, go ahead and book a call with either Dr. Martin or myself, and we can talk you through that, the differences in the machines and technologies. And we know some people we could, probably get you some discounts and refurbishments and all of that kind of stuff too. But again, and it's free, so we're there's no cost to this. Half hour of your time, or really whatever you need. Dr. Martin and I are both happy to spend the time that we need to spend with you. I mean, I think I can speak for Dr. Martin as well, in that we see you all and our colleagues in the profession really as friends. We've had so many people help us and be a blessing to us as we've been coming up through. We just want to see you succeed as well. And so, we're really not interested in your business. We're interested in your commitment to bettering what you're doing and serving your people, whether that's formally working with us or not. But anyhow, the link is there. Renee has the link in. Go ahead and click on that, book with Dr. Martin or myself, and we'll be happy to spend some time with you. Dr. Martin, is there anything else you'd like to share before we wrap up?
Yeah, I think thanks for everyone's time. That's one thing I really appreciate is your time is valuable. I hope that you got some things in perspective, and hopefully that just that can do attitude. Say if Dr. Dan and Dr. Martin can do it, then so can I. I hope that comes into your spirit, and I hope you just are a real blessing for your community. And like say, if you need some help, please, it's our pleasure to chat with you and see if we can help. And also too, because we are going to be doing this again, if some of these things you're like, geez, I really wanted to ask him about this, make sure, because we will be in contact with you. Renee will be reaching out with an email. So if you have certain questions when we do these webinars again and say, hey, Dr. Martin, I need some of these questions. I can't wait for the next one. I'd really like to be speaking to this. Put that into the emails when Renee reaches out to you and our team reaches out to you, to make sure that if you have, I really want to speak about this, and we'll see if we can weave that into our webinar, because we're here to serve you just like you're here to serve your community. So thanks for stopping by.
Absolutely. And guys, one last thing would be, like Dr. Martin said, as we do these webinars for you, get your questions in so we can speak to those, but also share the invitation with your friends, your colleagues, whomever, to join us. So we want to elevate the profession and elevate the level of service that we're delivering to our communities. And with that said, I always tell people that I'm an open book, and Dr. Martin's the same way. We have nothing to hide. Really, nothing's off limits as long as it's appropriate. I mean, we can go into detail, and in our coaching, we do. We might be working on SoftWave with someone, but they have a question about their team or hiring or bonus structure or schedule or, all of that stuff. So none of that's off limits. And, my dad told me this when I was little. He said, if you always tell the truth, you don't need to remember what you said or what you told people, and so like, that's always just come natural to me. And I'm very grateful for that. And it's a blessing, because it's like, our lives and our journey in practice hasn't been perfect. It's not, but we've had some really hard lessons and learnings. We're not perfect. We've had our struggles, but we've learned through that. And so, we like to help people shorten their learning curve. And so I think that's really the heart in it. And I don't see any last questions in there. So God bless you guys. And we look forward to seeing you guys soon.